Migraines. They can be quite troublesome for those who experience them. Imagine a throbbing headache, accompanied by nausea, sensitivity to light and sound, and an overwhelming desire to find relief. Migraines are a constantly increasing complex neurological disorder, affecting 1 in 7 people worldwide. They can have a profound impact on a person's quality of life, hampering the ability to work, socialize, and enjoy daily activities. Although the exact cause isn't fully understood, research has suggested that abnormal function of mitochondria in brain cells is associated with development of migraines. Mitochondria are powerhouses of human cells, generating 95% of the energy needed for survival and normal function. With mitochondrial dysfunction, brain cells experience a lack of energy and increased oxidative stress beyond the body's ability to handle it. This combination of low energy and high oxidative stress can lower the pain threshold in brain cells, leading to the development of migraines. So, what can we do to fix this? Research has shown that certain nutrients can reverse mitochondrial dysfunction and reduce the frequency of migraine attacks. However, it's crucial to be patient when taking nutritional supplements, as their effects on migraines take time to show, usually at least 3 months. One such nutrient is riboflavin, also known as vitamin B2. This vitamin is involved in the production of energy within the mitochondria. Studies have shown that taking high doses of riboflavin can enhance mitochondrial function and reduce the frequency of migraines in some patients. The reason behind this is that riboflavin is metabolized by our cells to create flavoproteins and flavoenzymes, which are critical for maintaining the health and function of mitochondria. A recent systematic review involving 673 patients found that taking 400 milligrams of riboflavin per day can improve migraine outcomes after 3 to 4 months of therapy. Hold on a second. Something important is missing here. If you do a little digging online, you'll find out our daily need for riboflavin is less than 1 milligram, meaning 400 milligrams of riboflavin per day is way above our bodily requirements. Plus, that's much more than what's typically found in a multivitamin. So don't take extra multivitamins just to get that much riboflavin. You'd end up taking too much of everything else, which can lead to some problems. In brief, despite minimal side effects, it's much wise to take daily 400 milligrams of riboflavin for no more than 4 to 6 months. Keep in mind that the limited data on riboflavin's side effects do not necessarily imply that high doses of riboflavin is completely safe and risk-free. Another nutrient that comes to the rescue is coenzyme Q10, a fat-soluble antioxidant that can improve mitochondrial function and reduce oxidative stress and inflammation, similar to what riboflavin does to help with migraines. Coenzyme Q10 is an essential component in the electron transport chain of mitochondria, which helps brain and muscles use oxygen and energy better. A recent systematic meta-analysis on 371 participants found that coenzyme Q10 appears to have beneficial effects in reducing duration and frequency of migraine attacks after 6 weeks of use. The recommended dosage varies in different studies, ranging from 100 to 800 milligrams per day. However, we suggest starting with a daily intake of 100 milligrams of coenzyme Q10 to see the result. The good news is combination therapies work as well. A recent study on 130 adult migraineurs was carried out to determine if taking a triple combination of 600 milligrams magnesium, 400 milligrams riboflavin, and 100 milligrams coenzyme Q10 could prevent migraines. The results showed that migraine symptoms and burden of disease were statistically significantly reduced following 3 months of therapy. Migraine days and the intensity of migraine pain were significantly reduced as well. So, armed with the knowledge of these nutrients, you can take a proactive step towards managing your migraines. Remember, it's not just about finding relief, it's about nourishing your mitochondria, boosting energy production and reducing oxidative stress. By incorporating riboflavin, coenzyme Q10, or even a combination therapy into your daily routine, you're giving yourself a fighting chance against migraines. Also, watch our upcoming video to understand how vitamin supplements can have adverse effects on prostate health.